Welcome to Why It Matters, where we tackle hot topics of the week. You will know by now of the Hepatitis C cluster outbreak at Singapore General Hospital, Ward 67. At least 21 patients were infected, 8 of them have died. I'm with Selma Khalek. She's the Senior Health Correspondent for the Straits Times. Hi Selma.
Hello Ernest.
Can you tell me, how did this happen and has it affected public confidence greatly?
Actually, the hospital is not really sure how it happened, but by elimination, they think it was because of multi-dose vials. That means you have one vial and several patients use the same vial for treatment. And it could only have happened that way if the doctors or nurses using it did not follow protocol.
Right.
Because if they had used a new needle and a new syringe every time, the infection would not have spread. But that raises another very worrying point, because if that can happen in one ward in SGH, can it happen in other wards? Were other patients being infected and nobody knows about it because you didn't see a whole cluster?
The timing of the disclosure, a lot of people have been talking about that.
You're right, Ernest, because alarm bells rang in SGH in May of this year, middle of May, I think, and the public didn't hear about it till October, and that's a very long time. SGH says it's because it wasn't an airborne disease, so they wanted to take time to investigate, but there's no reason why it took them until end of August before informing the ministry. And from the time the ministry heard about it till the time when the minister was told, there was also another lag of about 2 weeks. And I understand the minister was told on the 18th, but he wasn't briefed by SGH until the 25th.
Right.
They went public on October the 6th.
What is the key takeaway from this case, from the medical experts that you've spoken to?
Well, I think two things. One, all hospitals are now on higher alert for infection control, so that's a good thing because it's better for patient care. And secondly, I hope hospitals learn a lesson from this, and in future, if things like this happen, they should be upfront about it, tell people about it earlier, and not wait 4 to 5 months. With that sort of delay, you actually lose people's confidence.
Thanks, Selma.
Thank you.
That's it for this episode of Why It Matters. Join us for the next episode where we tackle hot topics of the week.